Well, it's been interesting in that, first of all, I've been invited to operate here. I have operated in many countries, but for the first time, this is almost like operating at home. It's been very comfortable. I've been to many countries where when I operate, it's a little bit scary because they don't have my equipment, although I always send my list before. They don't have the right team to work with me. So before I came here, the information was sent to me, which was very good. I sent information back as to what I needed. Everything was arranged. So I was made to feel very comfortable, which was very useful to me. And if I'm comfortable, I do a better job. And if I do a better job, it's better for the patients. So as it is, it's a risk to operate in another country, in another theater. So if you minimize this risk, it's better for the patient. And we're all here for the patient. So for the first time, everything worked really well for me. I thought the patient selection was good. I thought the theaters were superb. The equipment was very high-end. The anesthetist was brilliant. I have a brilliant anesthetist, and she was equally good. And my assistant was very good. So everything worked really easily for me. So it was a pleasure to operate here. So one of the things that I always do when I lecture is afterwards I ask the audience. I go around the audience because it's important for me to have feedback as to whether what I did was useful. So both after my operation and after my lecture, I went around and asked, do you feel it was worth coming here? And most of the people said yes. Do you feel that you learnt something here? And almost everybody said yes, they'd learned a lot. And so in that sense, I think it was a very informative and useful course for all the participants. I know from having organized conferences myself how difficult it is to organize a conference. It takes a lot of your time and a lot of your life to do so. So it takes a big commitment to make a course, especially a course that incorporates surgery. To have procedures done is difficult. Surgery and also fillers and Botox, as was done today. I think that requires a huge amount of organization. So Ramon leading and the rest of the team who are all involved, and I know there are so many other people who are involved in making these things happen, have done an excellent job. I think it's gone really well. I think the delegates have been happy, the faculty is happy, and I hope the patients were happy. So as a combination of the whole thing, a very successful conference. This institution with its protagonists, Ramon and Miguel, are very highly considered in the world of ocular plastics. And well done, bravo, Ramon.